the off period at night when hours several hours after my second or last dose of the day on the
Right.
Cinemed, yeah. But now
Yeah,
I
and that
have
can
like
help.
an off period during the day.
Right. It gets, the medicine starts working less well for shorter periods of time. And what I do, what Dr. Enos talked to us about, what I do is I put a machine inside your body called a deep brain stimulator, and this machine gives you access to a different type of treatment in the form of electricity delivered directly into your brain. And what the electricity does is it functions almost like a medicine that can help with certain aspects of Parkinson's disease. It doesn't cure you of the disease, but it helps certain aspects a lot. Like people who shake, it's really effective for shaking. And for the people who don't shake, it's really effective for the stiffness, the rigidity, and the slowness. Those things it really is
That's
good
me.
for.
The,
The
the
way
last
this
three.
works is that like the left side of your brain controls the right side of your body and vice versa. So we
Yes.
tend to do this one side at a time. So if you said your left side is the most affected side, we would do the right side of your brain to help with the left side of your body. So that's what we'll plan. And so whenever you think of surgery, first let's talk about the surgery. The surgery is putting this machine in your brain, and this machine, like other machines, is made of different parts. So the first part of the machine is a wire that goes into your brain. The second part of the machine is a battery pack that sits under your collarbone, just like a pacemaker, if you've ever done someone with a pacemaker. And the third part is an extension cord. It connects the battery in your chest to the wire in your brain. The whole thing is under your skin, so you can't see it. But what happens is electricity is generated in the battery, it gets carried up through the extension cord to the wire, and the wire delivers it deep into your brain. And what that electricity does to you all depends where in the brain I put the wire. So if I put it in one part of the brain, you'll hear funny sounds. If I put it in a different part of your brain, you'll see funny lights. And if I put it in just the right part of your brain, it helps with troubles of Parkinson's on the opposite side of your body. Now, whenever you think of any surgery, you always have to think of three things: risks, benefits, and alternatives. So I start with the alternatives because you know the alternatives better than me because you've been actually living with the disease. The alternatives are just to take the medicines. Next, we talk about the benefits. And what that means is that's a measure of how effective the surgery is. The good news is this surgery is very effective. It works on about 80 to 90% of patients. Unfortunately, it doesn't cure you of the disease, but like I said, it helps certain aspects of the disease a lot. It really helps the stiffness and rigidity and the slowness of the disease. It's really good at that. So once you talk about the alternatives and the benefits, now we have to talk about the risks. This is obviously where the river meets where the river meets the road. Anytime you cut the skin, there's a risk of infection. Our skin is the best barrier to all the germs around us. That risk is low; it's about 5%, but not zero. Unfortunately, if this were to get infected, antibiotics won't make the infection go away. If this were to get infected, you would need to have the machine taken out. And that's a tragedy for the people who get this because most people who get this, they love it. They don't want it out. But that's one risk. The second risk is we have to put this wire through your brain. And as the wire travels through your brain, it can damage your brain, causing a bleed or a stroke, make you weak on one side of the body, unable to talk, unable to walk. It can even take your life. The chance of that happening is very low, but it's not zero. It's less than 1%. So there's a risk of infection. There's a risk that even though we're doing the surgery to help you, there's a chance the surgery can hurt you badly. And then the final risk is that none of those bad things happen. Everything goes great. And it just doesn't help you the way you want. It just helps most people with Parkinson's. The surgery takes about 3 or 4 hours. Most people spend 2 nights in the hospital. Now, I've done all the talking. You can ask me anything you like.
I actually wrote down questions, Dr. Anand.
Great. Take your time. Ask me anything you like.
All right. What's the mortality rate, Dr. Anand, on
less than 1%?
Less than 1%. How about the success rate?
The success rate is better than between 80 and 90%.
And then the most common complication you have seen on your patients?
Infection, about
Infection.
5%.
So it's not stroke.
No, that's
What new meds will I be taking after the DBS, Dr. Anand?
so this doesn't change your medicines at all.
It will not change. I won't have new medication like
After you turns on the DBS and actually programs it, she would make some adjustments based on how the electricity is helping you.
I see. I won't be put on like blood thinner or something.
No, you can't take blood thinners. Yeah.
Okay. Do's and don'ts after DBS surgery.
The only don't is for the first 1 month after surgery, I don't want you soaking underwater like in a bathtub or swimming pool or ocean, because it's a fresh cut. It heals from the inside out. I always tell people I do this so you can have a more full life, not a less full life.
And then any supplements that I already take that are contraindicated when on DBS, because I take a lot of vitamin supplements.
No, that shouldn't affect this at all.
Okay. And then how long does the battery last once I have the...
So we have two types of batteries. We have rechargeable batteries and non-rechargeable. The non-rechargeable batteries will last 3 to 5 years, on average 4 years. And the rechargeable batteries last 15 years.
Okay. What will I be getting, the non-rechargeable?
Whichever you like. Whichever you like.
Okay.
You know, some people like the non-rechargeable so they can never have to think about it. Yeah. Other people like the rechargeable so the battery lasts a very long time. The nice thing about the rechargeable is that they last a long time and they're very small. It's the skinniest, smallest battery, so it's very small inside your body. That's the good stuff about it. The bad stuff is that you have to charge it. It's not, you don't have to plug anything into your body. It charges magnetically, but it's something you have to remember to do. So some people, they don't mind charging it, and they like the idea of having rechargeable. Others, they don't want to think about it ever, so then they like the idea of having the non-rechargeable. Does that make sense?
Yes. From my understanding, there are two companies that make the DBS. Which one is better?
There are 3 companies
that make the DBS.
3? Yeah, so Medtronic, Abbott, and Boston Scientific. I like all 3 the same. I usually just put in whatever your neurologist wants. I think your neurologist, Dr. Yu, had recommended Boston, if I remember correctly. But I like all of them the same. They're all very good.
Okay. How do you know that you are in the right place, Dr. Anand? Is it CT guided?
You'll be awake during the surgery, and so I make sure you don't take your medicines the day before the surgery, so you're going to be very, very stiff. And then with you awake, we put the wire in your brain, and then we see if you get the results that you want. Then that means we know we're in the right place. If you don't, that means we know we're not in the right place. So we move it based on how you're doing.
I see.
Is it a big hole?
Is it a big hole in the...
No, the size of a nickel.
Size of a nickel. Okay. Do I shave my hair off, Dr. Anand?
No, I'll give you a funny haircut.
It's okay, I'll wear a wig. Or the wig might bring infection.
Yeah, no, we don't want anything on your head.
What else questions have you?
What other questions do you have?
Does it hurt, the surgery?
Dr. Anand, is it possible for me to talk to like patients that you did DBS?
Yes, Dr. Yu can help set that up.
Oh, Dr. Yu.
Dr. Yu, okay. Just to kind of, give me an idea from the patient's perspective. So how soon would I be able to get the DBS, Dr. Anand?
Somebody from our office will reach out to you in the next few days, and it usually takes about 3 months.
Okay. Anything else, Papa? Any website you recommend, Dr. Anand, that I can kind of read about the DBS or I just go through YouTube?
Yeah, I think go to YouTube. There's a lot of videos on the DBS. Read about it. There's like, you can see like Channel 9 or CBS came into the OR and has done a news segment about me doing a DBS. So there's a lot of
Okay.
information. You're welcome to, Google it, look up all you want. And then in the week to 3 weeks before the surgery, we'll have another meeting, you and I, and you keep a list of all the questions you have, and you write some more questions down, and we'll go through all this stuff again.
Okay.
Does it hurt? Do you feel it? Are you numb or something?
Do I? My
No, this is
husband's
not a
asking if I.
this is not a surgery that hurts. You won't have any pain.
Or you won't feel it like that?
I won't feel anything while you're working on my
Brain?
my.
Brain?
That's right. That's correct.
I get numbed up, huh?
Oh, okay.
That's right. Yeah.
What else? Oh, because we live in Corona, it's kind of where is the facility that you work for the surgery?
In Kaiser Woodland Hills.
Woodland Hills.
Oh, yeah. We could go there.
So, and then I stay in the ICU, Dr. Anand, after the surgery?
No. If everything goes well, you'll be on the regular floor, just 2 days.
Okay, for 2 days.
I recall.
I'm in the regular floor for 2 days for medication or
Observation.
just for observation?
Observation.
Okay.
That's good. Not all.
Will my husband be able to stay with me in the room, or do they allow?
Yeah. They allow.
Okay.
That's good. Perfect.
Because that will help ease my anxiety.
Sure.
What else? Any other questions,
I
Papa?
think that's it, I think Dr. Anand covers everything.
So if I ever have a question, Dr. Anand, I can message you through kp.org.
Of course.
Okay.
Okay.
This is since 20 years ago, Dr. Anand. How long have you been doing this?
20 years.
20 years?
Wow.
Yeah.
Because we've only heard about it just now. So I'm like, even my friends don't know about it. I said that the information told me it's been 20 years. So, but it's not for all
Qualified.
Parkinson patients, right, Dr. Anand?
You have to qualify.
No, not for
You have to
all
qualify
Parkinson's, but
for
the
it?
majority of Parkinson's.
Okay. I asked Dr. Yu just one last question. I asked Dr. Yu, how come Michael J. Fox did not get one?
Nobody knows except for Michael J. Fox.
Maybe he declined it, huh?
Yeah,
And
he's,
then-
he's the only one. He's the only one who knows why he hasn't gotten it.
Yeah, because it's like he's the champion for Parkinson, so he should have gotten it.
He really should have, but only he knows.
All right, Dr. Anand, thank you for your time,
Thank
sir.
you for your time, sir.
All right, it's really nice to talk to you. All right, bye.
Okay.
Bye-bye. So he called early. Oops. Stop.